Hola. Okay, okay. Hello everybody. So while everybody is joining the meeting, I'm going to start with the introduction. But before I continue, please remember to activate your subtitles in this option that Zoom has. And if you have any question, please feel free to write in the chat in Spanish or in English. So, okay, so we are Qhali Peru. This is a study group in dental public health. The mission of our group is to promote a specialty of dental public health among undergraduate and graduate students in Peru and also from other countries where Spanish is the main language. And if we are talking in English, it's because we would like to practice this language to learn more about this discipline too. So the mission also is to contribute to the development of their skills as researchers in this area, to generate spaces for scientific dissemination, and in a long term, to propose interventions to improve the oral health and reduce inequities. Our vision is to be a solid group with members from all Peruvian regions and dental public health researchers from different parts of the world who collaborate with each other for their development as researchers and to generate or improve oral health interventions among the Peruvian population. So today we will have our last discussion forum, and the discussion forums were created with the aim of increasing the knowledge of basic dental public health concepts and the awareness of the existence of this discipline among all the students from Peru. So we have had 6 different discussion forums since May. So all these forums are recorded and published in our website. So for example, we started having this discussion forum about the practice of dentistry and dental public health, then about the impact of the social determinants of health on oral health inequities. Our third discussion forum was very interesting also about oral health and systemic conditions. Then we had challenges in health promotion and prevention of oral diseases. And the previous one was about assessing risks for oral diseases at the individual and population level. So after each of the discussion forum, the members of the groups created these infographics as a summary of what we discussed during this type of meetings. And today we will have a very important and interesting topic that is planning, implementation, and evaluation of dental public health programs. We have a special guest today who was guiding the readings for this forum. He's Fabio Arriola, but before we introduce Dr. Fabio Arriola, I'm going to introduce Abigail. Abigail is a forum coordinator. She is graduated from the Faculty of Dentistry at the Universidad Nacional Federico Villarreal. She obtained a second place in the Training and Human Talent Development for Oral Health category of the contest, Telehealth Strategies in Dentistry in the Context of COVID-19 by POPs. Her research interests are about dental public health, pediatric dentistry, and minimally invasive dentistry. So thank you so much, Abigail, for organizing this forum, for coordinating with all the group. So now it's your turn.
Thank you, Dr. Camila. Thank you, Fabio, to be here. So let's continue. Next, I will present Dr. Fabio. Fabio Herrera is a pediatric dentist that is currently pursuing his doctoral degree at the University of Toronto in the discipline of dental public health. Through his educational and clinical career, he has had the fortune of working in different research fields and seeks to continue bridging the gap between research and clinical dentistry. He is currently immersed in health service research with the intention on improved application of oral health interventions and service for pediatric population, especially seeking to benefit those most at risk for oral disease. Fabio's other research interests include the study of minimally invasive dentistry in animal defects and their clinical impact behavior guidance in pediatric dental visits, social determinants of health, and risk factor for pediatric patients, and culturally safe care competency in health service. In his free time, Fabio enjoys swimming, reading, watching movies, going to the beach, and connecting with his family back in his home countries of Guatemala and Mexico. So thank you, Dr. Fabio, to be here with us. It's a pleasure to connect with you, and so you can start.
No, thank you. On the contrary, I would say the pleasure is mine. And thank you very much to Qhali for the invitation. This is, I know, something that's very special to a person that is also special to me, who is Camila, Dr. Camila. And I truly hope that today is something of benefit to all, to share a little bit of what I'm very interested in, and give you guys an idea a little bit on this topic. I just want to double check. Can you guys hear me okay? And can you see my screen? Perfect. All right. So today's talk, I'll just jump right into it. Like I've been very generously introduced, is around planning, implementation, and evaluation of dental public health programs, right? So within my research interests and work interests, this is a lot of where I'm focused. Just as a little bit of a background, like Dave mentioned, I'm a pediatric dentist. And I think a lot of the times effort is invested in trying to understand how to better approach patients, obviously from a health services perspective, no? But we know that health services are complex and they're very different from context to context, no? So you're gonna hear me talk a lot about context and how context matters, right? And how place has and should have a particular way of doing things. Now, having said that, planning, implementation, and evaluation, they're all sciences, right? So we also have to have that scrutiny when we are applying them, right? So I hope that through this talk, I help you understand a little bit of the differences between the three disciplines. Because if I'm being honest, um, I, you know, a while ago used to think that three disciplines were the same thing and there's no differences and one thing is just following the other. And it's actually not so much that, right? They truly have something to explore. And we're going to talk a little bit about this, the basis of the theories behind their science, as well as some of the things that are happening with dentistry with this. So, I was asked to share a little bit about my personal and academic trajectory, and I'm very happy. Like it's been mentioned, I am both of Guatemalan descent and Mexico. My dad's Guatemalan, my mom's Mexican, and I lived there basically for a significant amount of my life. Nevertheless, I studied dentistry in a city called Mérida in the state of Yucatan. It's in the Yucatan Peninsula in Mexico. And that's where I had a 2-year residency training in mostly clinical pediatric dentistry. But now, you know, and the way that life has taken me, I'm in my 2nd year of dental public health alongside Dr. Camila and Dr. Anna, whom you met. And to be honest, in my head, public health has just always been something that has been very important. For me, there's no way for us to think about patients and think about health if we don't think about equity, and we don't think about actually giving health to all those who need it, no? And especially all those who are been made vulnerable by different systems, right? So, once getting into pediatrics, that made me realize it a lot more, and the importance of introducing public health and public health education, awareness, knowledge from an early age, right? So this has been a little bit of my trajectory, a little bit of where I am, and hopefully a little bit of where I'm going, right? My two big passions essentially are being merged with public health and pediatric dentistry. So let's start talking a little bit about this, right? So I have a question for everybody here. Why do programs or interventions end up looking like this a lot of the time? Where maybe you start and you have a beautiful idea, beautiful beginning, maybe because you started at the end, but then as you draw it, they end up looking like my drawings, like Fabio's drawings. So if we have any volunteers, anybody that wants to talk, what do you think are the situations that lead us to this? Why does this happen so often? Because this is more common than we actually think.
I just want to say, like, if somebody wants to share something in Spanish, please feel free to do it. Fabio, as you hear, Fabio is from Mexico, so he understands Spanish perfectly. So,
Don't be shy, don't be shy.
yeah,
Don't be
but
shy,
obviously
yes.
we also are speaking in English because we would like to practice. But if you understood the question, feel free to share it in Spanish. Hey, Valeria.
Vale.
Valeria, Valeria.
Buenas noches. Me gustaría poder hablar como que en español. ¿Se podrá? Sí, ¿cierto? Bueno, con respecto a la pregunta y a los artículos también que compartieron, siento que todo está muy relacionado con la manera en cómo se da el flujo de armar estos proyectos, empezando sobre todo porque no se toman en cuenta los recursos antes de los objetivos. Muchas veces se sientan y dicen, bueno, tenemos estos recursos y con estos pocos recursos podemos lograr tales objetivos y se limita mucho. Entonces, en nuestra cabeza podemos intentar como que salvar a la mayoría de esa comunidad, por así decirlo, salvar o proponer un proyecto que sea lo más efectivo y tenga el mayor alcance, pero con los recursos limitados no se puede lograr. Y justamente eso pasa mucho en salud pública, que estamos muy limitados por los recursos y por el poco apoyo que se tiene. Entonces es como que la expectativa y la realidad en esa imagen para mí.
Thank you. Thank you. Yes, 100%. No, really thinking about the idea, executing it, and then evaluating it or looking at the outcomes, sometimes it's so disconnected, because sometimes it's the scientists who have the idea, and then it's, the policymakers that put the money, but then it's the actual clinicians who have to execute that idea. And if nobody's speaking to each other, then this is the result, right? This is unfortunately a lot of times the result. And I think the idea around resources that you mentioned is very relevant, because then of course we have a waste in resources a lot of the time when resources are already very limited, right? So yeah, I think that's excellent. Very good. Does anybody have any other idea here else to share? All right. So what we're going to talk about today is basically this, right? Why do programs end up looking like this, and what we can do so this doesn't happen? Now, having said that, I think this image is very representative of the three topics today: planning, implementation, and evaluation. Because the way I see it, you need a lot of science and knowledge, yes, but you need a lot of creativity a lot of the time, okay, to understand how programs or interventions are best going to work in your context. Okay, so let's remember or keep in the back of the mind that creativity, as we can see it in this picture, is very, very important, right? But putting it all together, that's the tricky part, right? So this is a little bit like we said of what we're going to talk about today, right? And essentially, we're going to be looking at defining each science or each part, disentangling the differences amongst each other, and talking about the relationships. We're going to talk a little bit about the challenges that exist in dentistry and dental public health around these topics, and then we're going to get to the questions that you guys have submitted around the readings. Okay, so as we talk about these, I'm going to talk about them separately, and then I'm going to talk about them together, just so we have the basis, and then, we'll merge. We'll put them all together. Okay. So the thing with program planning, right, is that I think a lot of the times we think of program planning as something that is logical, right? Oh, how do I start something? I start from zero and then I go here, right? And if you look at the definition, right, of program, right, organized set of activities and efforts where we're trying to make some kind of change, right? Especially with recipients within their environment, right? That's a program. Planning is how we systematically approach these, right? How we define a problem, identify the settings, the priorities, develop goals and objectives, and determine alternative strategies and methods of application. So program planning is basically how we get from point A, which is starting that program, to point Z or point Y, or just the final point that is essentially an understanding if that program worked, right? So a practical way to look at program planning is through structure, right? And the CDC, the Center for Disease Control, has a tool where they propose of how we use evidence-based resources for program planning. Now, this I think is very particular to the context of the US, but I think the points that they touch on are very important when we talk about different program planning strategies, right? So when we program plan, we have to identify the need, okay? Why do we need this program? Why do we need this change, okay? And actually, we need to stop thinking about the need from us, okay? Just because we have the knowledge, okay, doesn't mean that we know what is best for other populations, okay? And this is essentially where we need to start integrating community partners, okay? And when we identify the need, we need to we need to start by talking to the people, okay? Because a lot of the problems with program planning essentially come down to the fact that programs are planned based on what researchers and policymakers thinks is correct, but not really on what populations need or want. Okay, so that's really, really important. Okay, number two, I think it's important. You need to see how this aligns with national goals, especially if we go back to what Valeria was talking about, right? Resources, unfortunately, are scarce, especially maybe more in our Latin American contexts, right? So we need to understand how our program, right, what we want to do matches and fits with other goals, right, that are happening somewhere else, right? If there might not be resources for dental research, maybe there's resources for non-communicable diseases, or maybe there's resources for diseases that are related with systemic health, like Abdul talked about, right? So we need to find a way to match the ideas and the needs of our communities with the national needs and the resources that are available, right? Because if we don't do this, then hardly are we ever going to be successful with this, right? Now, when we talk about evidence-based resources to match those goals, right, this is a little bit more of where we're going to talk about implementation and evaluation, okay? Designing plans and interventions is very important, especially in new contexts. But we need to look at what else is out there in the literature, right? So we need to understand what has worked, what hasn't worked, why it's worked, why it hasn't worked, right? That's really important. Now, for example, here, I disagree a little bit with putting this here. Engage with your community partners and ask for feedback. Because like I said, essentially and ideally, this part over here should be here, should be embedded in the first part, okay? So engaging with community partners is important from the very beginning, okay? Because once again, we might think we have all these excellent ideas, but we need, if we really want our program to be successful and for people to use our programs, to use our interventions, then they have to want it, they have to need it, they have to understand, right? Why we're doing it, right? And if we don't integrate them from the beginning, then a lot of the times then we're not going to be very successful, okay? All right. We have to draft an intervention plan, right? And this is a little bit of where implementation science comes in, and we're going to talk a little bit about that in a second, as well as effectiveness studies, right? We have to gain support for the initiative, once again, from inside the community, as well as the people whom we're asking resources from. We have to implement our plan. Our plan implementation can have lots of ways and manners that we can look at it. But ultimately, at the end, what we have to do is evaluate that plan. Is this plan working? Is my program working? Is my intervention being successfully updated, right? So out of the three, implementation and evaluation, I think planning is the simplest one because I would say it's the most linear. Okay. If we think about it in terms of how we apply it, okay, this one is a little bit more of like a recipe. Let's think about like a recipe, like you're cooking, okay? You do this, and then you put the tacos, and then you put the meat, and then you put the salsa, okay? That we can think about this a little bit more in a type of recipe, right? With program planning. It's a little bit more linear, yes, and it has embedded in a way how we implement our plans and how we evaluate our plans. And as we're going to learn a little bit about today, evaluation doesn't necessarily have to come in the end. Evaluation can be here, evaluation can be here, evaluation can be here, evaluation can be here, okay? So what we have to think about this, I go back to the word of creativity, okay? We need to be creative with the problem that we have, that we want to approach, and also how we approach this, all right? Very good. So I have here an example, right, of from dental literature, right? I didn't share this with you guys, but I'd be more than happy to share this later on. These are just more specific papers, right? And here, this set of authors study titled "Designing Complex Interventions: A Description of Development or Intervention to Reduce Inequalities in Planned Dental Visit," right? So essentially, what the authors argue here is that they wanted to understand how we reduce inequalities with patients approaching the system, right? Their main question is why are patients being or not accessing our services the way that they should, okay? Here, they use something important, which you might have read about in the reading, which is theory, okay? You're gonna read in these a lot about TMF, okay, or TMFs in this field, theories, models, and frameworks, okay? Planning, implementation, and evaluation depend a lot of these on theory, model, and framework. And we're gonna talk a lot about frameworks today. So here they use theory, okay, to understand behavior change techniques and to make dental visit intervention a little better, okay? And essentially what they came up with is a model, okay, where they identify the problem. They wanted to see what the targets were, you know, affordable resources, oral health awareness, trust in dentists and the dental system, self-confidence, and emotional response, right? And they did all of the system works, okay, on how we can get patients to better be accessing our services. So here they are planning. We are planning for our patients, for our population to better access. And there's a lot of elements here, right? So for example, there's an economic evaluation component, there's a behavioral component looking at, in this particular case, dental anxiety, there's a pharmacological component, right? So there's lots of components, right? And essentially that's the thing about a plan within a program, okay? It has a lot of pieces, it has a lot of parts. And a lot of the times for a program to be successful, you need a lot of experts. You need somebody that knows about economics. You need somebody that knows about clinical. You need somebody that knows about health services research. You need somebody that knows, so you need a little bit of everybody to actually put this together. And this is something that you'll find in the literature, complex interventions, okay? Because you have simpler interventions, which are a little bit more A to B, but the majority of interventions that we deal with in health services research are considered complex, okay? Why? Because we have many, many, many moving parts to them, okay? Very good. So in this next part, we're going to talk a little bit about program evaluation, okay? And the one thing I want to say about program evaluation, okay, is that we need to stop thinking about evaluation as something that happens at the end, okay? Evaluation happens from the beginning, necessary, the beginning of the program, okay? And I think it's the semantics, it's the word evaluation, maybe because we think of the exams, an exam is an evaluation comes after you complete a task, okay? But there's different types of evaluation. And if you guys saw the little, the article that the CDC or the printout on evaluations that the CDC gives, it gives examples, right, of when we do the different types of evaluations, all right? And we're going to talk about that in a second. So what's program evaluation? Systematic collection and analysis of information for program activities, characteristics, and outcomes to improve program effectiveness and or inform decisions about future programming, okay? So it has different goals. We want to understand the elements of our program. We want to show how the program is working. We want to measure the effectiveness, no? The same way we measure effectiveness in a clinical trial, we need to measure the effectiveness of a program, okay? It's the same thing. You have variables, you have outcomes, you have measures, you have everything that you would have in a regular manner, right? And a program evaluation can actually be a randomized controlled trial. It can accompany a clinical component many of the times, okay? So we need to think of it that it's very broad, and the methodologies that we can use to approach them are also very broad. And we can also use program evaluation for guiding policy and funding, right? So here, when we talk about the different types of program evaluations, we talk about a formative evaluation, where we understand the program elements. And like the name says, formative, information, when the program is still in its process, in its formation, okay? A process evaluation shows how the program is working, okay? So let's see. I'm gonna try to be a little bit more, let's see. This is the beginning. Like, let's say this is T0, just so we understand this a little better. And let's say this is T1 or T final, okay? Whatever you want to call it. Okay, so formative, right? We want to understand the program elements. We would do the evaluation here at the beginning. Process evaluation happens here, okay? Happens throughout the program. You can evaluate the program here, you evaluate the program here, you evaluate the program here, and you change the program if it's necessary until you get the formula right, until you get your cooking formula, because you want those tacos to be very good, right? So until you get the taco recipe right, you're going to keep evaluating, and it's possible for you to change, okay, the formula. But that's why we have a process evaluation, right? Because the process evaluation allows you to change the elements, okay? Then you have what is most common, okay, which is an outcome evaluation, okay? You do this at the very end, okay? This is the final. I think this is what we normally think about when we think about evaluation, okay? Outcome evaluation. I want to see 2 years after if my program worked. okay? But this is not necessarily how we do things, because maybe you do an outcome evaluation, it's like you wasted 2 years of time and resources. That's not the best, right? So outcome evaluations are very good when resources are limited, when information is not available readily or periodically, right? But essentially, you want to be doing evaluation throughout your whole program. And you can do this through formative, you can do this through process. And these are just some examples. There's so many evaluation designs that you can use. And another type, for example, is impact evaluation. So in your impact evaluation, you want to look at it more from a societal perspective, okay? What was the impact of your program on the society, okay? While outcome evaluation might look more at what the variables, more a classical clinical design, right? My variables came to this and then got to that, right? While impact evaluation is a lot more society focused. Yes, Camila.
Yeah, I wanted to ask you if also it's possible to measure to do the outcome evaluation at different points of time. For example, if we are measuring caries increment or caries reduction, if we have like point times, like that, something like as including an RCT as part of the evaluation, right?
Yeah. So you could, the only thing about using an outcome evaluation is that your variables are fixed. You can't change it. You don't have that possibility of changing your program, right? So you can be doing and you can be reporting. Yes, it's possible. Have the time and if you have the resources, then maybe better to do a process evaluation or a developmental evaluation. That's another type of evaluation that is also ongoing, right? So outcome evaluations, I think, are very good just because they're very defined. They're very well defined in the literature of how you do it. And they're very efficient with resources. That's the thing with outcome evaluation. Definitely the other types of evaluations need a little bit more time, need a little bit more money, right? But yes, you could be doing a periodic outcome evaluation, but just keeping in mind that you can't change anything for your program because this is a little bit more rigid, let's say. Very good. And then like these are 4 types. There's more than 15 types of evaluation. And that CDC considers economic evaluation, what Dr. Camilla works, as a type of evaluation, right? And a lot of the times you mix, okay? You mix. Maybe you have an impact evaluation with an economic evaluation, or you have a formative evaluation with an outcome evaluation, right? Or you mix it with an implementation strategy, right? So there's, once again, it's about getting creative and really understanding your problem and understanding the best way to approach that problem. So really quick here with evaluation, I think I'm just going to mention important elements about this. Something that's very important is a logic model. Okay, a logic model. I don't know how to zoom here. I'm so sorry, guys. But a logic model, basically what it is, okay, is a roadmap. It's like a little map, okay? What is my situation? What are my priorities? What do I have? What are my inputs? What resources, what human and financial resources do I have? What are my outputs and what are my outcomes and my impact in the short, medium, and long term, okay? And then you have assumptions and you have external factors, et cetera, okay? So a lot of the times when we talk about evaluation, program evaluation, you have this, which is your logic model, which is where you should be starting your program and where you are going to be able to measure your evaluation outcomes and put them into your model, right? And another thing here that's important is that evaluation uses models and frameworks. Like, for example, one of them is the CDC evaluation framework. Another one is the REAIM, which is the Reach, Effectiveness, Adoption, Implementation, and Maintenance framework. Okay. And basically what these frameworks are is that they give you the recipe. So if you look at the CDC evaluation, stakeholders, describe the program, focused evaluation design, gather evidence, justify conclusion, ensure use and share lessons shared, and then you go back to engage stakeholders. Okay, so basically frameworks are that. Okay, they're the, okay, you do this step 1, step 2, step 3, step 4. No, and there's lots and lots and lots and lots of types of frameworks. Okay, once again, you have to get creative on how to use those frameworks according to your particular problem. All right, very good. Oh, Camila made a logic model to create this study group. Yes, very, 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 very useful. All right, very good. So I'm gonna move on to implementation just because I'm aware of time. Okay, but if you have any questions, please do stop. Okay, so for example here, okay, I have an example. I believe this is 2022, 2023 of what I considered is a pretty well done program evaluation. Okay, so first, for you to identify let's call it a good evaluation, it has to have a name and a last name. Okay, so the last name, evaluation, like I am Arriola. Okay, the first name, outcome. Okay, you're telling me the type of evaluation that you're doing: economic evaluation, developmental evaluation, because just saying program evaluation is not okay. You have to tell me what type, how you did it. Okay, because every type of evaluation has its own specific, you know, kind of way of doing, right? So it's really important that when we read about evaluation literature, that it's pointed out or it's identified what type of evaluation we're looking at. Okay, now, here I found something interesting about this one. Let me talk a little bit about context. Here, what they wanted to do is evaluate a program with a pediatric mobile dental unit where dental students provided care to children, to underserved children in the United States. Now, the thing with evaluation is you have many types of designs that you can do. It could be cross-sectional, it could be longitudinal, it could be, there's many ways of doing it, right? So here you have longitudinal, outcome, evaluation, research design. Once again, here there's a very clear defined way of how the evaluation is doing it and why it's being done that way, okay? And then here they analyze records from 10 years, okay? So it has to be an outcome evaluation because all you have is kind of like looking at those records, kind of like secondary data, right? This is where outcome evaluation is valuable, right? Where we understand how things have happened with not much resources that we have to invest, okay? And as part of this article, they share the logic model, right? Once again, what do we have? Input, activities, output, outcome, and impacts, right? Their input was the dental students, the human resources. The activities was providing dental care. The output was the experiences with children, talking about dental need and organizing schedules. And the outcomes, right? Improved quality of care, enhanced efficiency, and the impact: high learning experience for the dental students for their input, increased delivery dental of care, you know, for their population, increased access care to underserved populations. Okay, so here this is very clearly tells me, you know, how my program is functioning. Okay, and when I want to do another evaluation, all I have to do is pick up these elements, okay, put them into a new model and see what has been working and what has not been working. Okay, so this is a very simplified idea of how an evaluation is done, right? Because there's a lot of other elements that you have to put in, right? But you get the idea here that you need to understand what type of evaluation you're doing and how your program or your context fits in a way that makes sense or that is logical in the logic model. Sorry for the redundancy, but essentially it's that, right? Making things logic. That's why the logic model is called what it is, right? Because it kind of gives us this order of the different elements that we need. Okay, very good. And finally, we have the newest, I would say, of all of these sciences, right? Which is implementation science. So when you read about implementation science, it started around the 40s or the 50s with dissemination science, but it truly became more of a formalized science in the 2000s, okay? So essentially, is younger than me. I don't know if younger than you guys. But the thing about implementation science is that looking at program planning, they were looking at program evaluation and they were saying, hold on, we're still having problems with this. There's still something that's missing. And one of the things that implementation science has recognized is that it takes 17 to 20 years for an innovation or an intervention to go from the lab, to go from the researchers, and to actually get to the patients or to the population. 17 to 20 years. Okay? Another staggering fact that they talk about in implementation science is that about 45% of money that goes into research ends up being research waste. It never gets applied the way it's supposed to apply. Sure, the researchers publish their papers, they go to their meetings, a lot of medals. A lot of academics love medals, right? Nevertheless, the problem here is, right, that there's a lot of money going into research that's supposed to benefit society, but a big part of that money is being wasted because it doesn't actually get implemented in the correct manner. So essentially, implementation science is the scientific study, right, of the methods to promote the systematic uptake of the research findings and other evidence-based practice into routine practice and to improve the qualities and effectiveness of health services. So essentially, implementation science says, hey, everybody, we need to get together, okay? We need for the researchers to really be doing research that is for the people and that is going to reach the people, okay? Because there's a space right now. There's a space between research and actual impact, okay? And implementation science basically is the study or the science of that, okay? How do I make sure that what happens in the research with the researchers actually gets to the community, right? So what do? They describe or they guide the process of translating research into practice. So it's like, okay, give me your little hand. I'm going to walk with you until you actually get what you're supposed to be doing, right? We want to understand or explain what's influencing implementation outcomes, because that goes back to the picture of the horse. Remember the horse, okay? You might have an excellent idea, but if that excellent idea doesn't actually get implemented correctly, then you have a problem. You wasted all of this money with this idea, all of this time, because it's never actually going to make a difference, right? And we also need to evaluate how these implementation strategies are being done. And similar to evaluation, there's different types of implementation, right? So within implementation, you can focus on design of innovations and or programs, on application, how we apply these innovations or programs. We can evaluate how these outcomes are being implemented. And we can also have the implementation, okay? So maybe let's put this example. There's this group of dentists that want to keep using amalgams. They want to no, I love the amalgam, I love the amalgam, I love the amalgam, I love the amalgam, right? And there's nothing you can do to change their love for amalgams, okay? The implementation does that. They go in, study. Why do these dentists love amalgam so much? What is going on? Did the mercury finally get to their brain? So that's essentially what de-implementation is. How do we go and we change, okay? And here change is behavioral. A lot of social behavioral science comes into implementation because you want to understand, how do patients better use things? How do practitioners better use things, okay? How does the society adopt this, implement this, sustain this, okay? Now, for this, there's a lot of frameworks. One of the more famous and used one is the Consolidated Framework for Implementation Research, CFIR, okay? And this is a model that they use a lot, okay? Where we have the intervention, we have the outer setting, The outer setting is what's happening with the politics, right? So like what's the funding strategy, what's the government, et cetera, et cetera. You have the inner setting, which are your patients or your participants, okay? And then you have your intervention, right? And you measure this throughout your process, okay? So for example, CFER, they use a mixed methods approach because they have interview guides, to like they ask patients, what do you think about this intervention? Is this intervention good? What needs to change about this intervention? They ask managers, okay, hey, what do you think about this intervention? Is this intervention correct for your setting? They ask practitioners, they ask the dentist, right? Like, why can't you change amalgam? Why does the composite not the better option, right? Okay. So in a multi-level, that's the sampling strategy that's used here, multi-level, because you talk to different levels of people. Okay. You try to understand what the situation or the context is around your intervention or around your innovation and how to better implement it, right? And we have lots of other frameworks, right? We have the knowledge to action framework, which is how do I get from the research phase to the institutionalization phase, the COMB, which is capability, opportunity, motivation, and behavior, which is how do I change behaviors of patients? How do I change behaviors of practitioners regarding a certain implementation? So, for example, this, and please, anybody use this idea because I think it would be super interesting. I think it would be very interesting to use with fluoride hesitant people, fluoride hesitant parents, to understand, right? Why is there that hesitancy? How you can change that hesitancy, right? So this is a lot of what implementation science does. I have an evidence-based intervention. I have an evidence-based program. How do I implement it better? How do I get everybody to be on my team and to adopt that strategy, right? And we have pre-seed and proceed. Once again, here the frameworks are endless. It's once again understanding which one of the frameworks, which one of the models best work for your problem, right? For your question, for your research question, right? And if we look at an example here from the dental literature, this study, which I believe is 2022, if I'm not incorrect, is titled, Use of the Consolidated Framework for Implementation Research, CFER, what I mentioned, to assess determinants of silver diamine fluoride implementation in safety net dental clinics, right? So what do, right? They familiarize dental personnel with the SDF protocol through on-site education and feedback sessions, right? And 2 months after, they conducted focus groups, okay? And they looked at the different elements, like, do we implement SDF in this setting? So if we think about this is part of program planning, but the difference is in program planning, I go and I say, we're gonna do this. With implementation science is how do I design a program? How do I design an intervention that is looking at what? That's looking at the intervention characteristics, that's looking at the patient needs and resources, that's looking at policy and incentives, that's looking at culture, that's looking at so there's frameworks that also look at equity, look at racism, they look so there's lots of elements, right? So as opposed to program planning, which is a little bit more linear, a little bit more let's call it mandatory, like you're mandating what's going to happen. Implementation looks at the different things, right? And they look here, right? It's like, oh, it's a low cost alternative, right? There's a good culture in the clinic to adopt it, right? Training is needed, right? Because maybe you go to a practitioner and you give them this thing, right? You're like, oh, you're going to use SDF now. You're going to use this new product, silver diamine fluoride. Go. Here's how you do it. And that's the reason why programs and interventions fail, because we're not looking at the different elements that are part of implementing those strategies for them to be successful, right? And like everything, implementation can be successful and it can be unsuccessful, right? But before I invest more time and money, I know what it is. I know if it's successful. I know if it's not successful. Okay. And there's different ways and frameworks that we can use to understand if this is the correct manner or the correct way to go about things. All right. So this is a pretty new science, I would say. So I think there's a lot of exciting things that are coming from implementation science, and I think it's just logical that we do things through implementation science. And essentially, what I want to get to is that we need to understand that the three elements need to work together, and they share elements, and they share goals, and they share outcomes, right? And I guess the way that I would most kind of resume this, right, is that program planning is the plan, right? The thing I have to do. Implementation science is how we do the plan, okay? How we apply the plan, thinking about everything, okay? Not only thinking, oh, SDF, it's the best thing, WHO, and this and that. And no. I need to talk to the patients. I need to talk to the practitioners. I need to talk to the decision makers. I need to talk to decision makers. I need to talk to the managers of the clinic or the hospital or wherever, right? So it's how we do the plan. It's not sufficient now to be like, oh, this technology, this innovation, this program is the best because my p-value was less than 0.05. Okay, that is no longer and truly has never or should never be acceptable, right? We have to understand that even if things are clinically effective, we need to understand the context on how to do it. And program evaluation is essentially how we check the plan. Is the plan going okay? Is it not going okay? What needs to change? How do I better improve it? Okay. So there's a lot of overlap with program evaluation and implementation science, if you notice. And there's actually frameworks that are shared. There's a lot of frameworks that are shared between the two. It's just taking different elements depending on what you need to do with your plan or with your program. Okay. So what are, and this is coming from me, challenges in dentistry or in dental public health, right? So here we have, this is me at the party, like dentistry. Well, this is me talking to the other evaluation and implementation people, right? Like they don't know I'm not very good at planning, evaluation, and implementation. And of course, people know. Of course, they know that we are bad at these things, okay? And the reason that I call this, and this is all coming from me, is that because we're always late to the party. Okay. Dentistry, in a lot of senses, sadly, is a little late to adopting and understanding social determinants of health. Dentistry, and Camilla will not let me lie, was late to getting to understanding the importance of economic evaluations. Dentistry, once again, is late to understanding how we use planning, evaluation, and implementation, right? And why? We're interested in selling stuff, right? We're interested in, the nice white teeth. We're interested in, all of the things that don't really impact the people that need it the most, right? And this is, I think, multi-level, right? Patients, sometimes are not interested in more than aesthetics, okay? They have the abscess, but they want the whitening, right? Dentists are a lot of times not interested in giving public service because they want to make the money, right? Policymakers are not interested because it's like, oh, it's a tooth, whatever. You have two other teeth, right? So essentially, the thing here is that we're not making our case. We're not selling our products, right? In the way that we should be doing it. And we're getting late to planning, implementation, and evaluation. Okay. And if you look at the literature, it's disappointing, I would say. But this obviously has to change, right? And this is me right now. Like, what do I do? Do I say more evidence is needed? Do I blame the dentist? Do I blame the different levels? Do I blame the different actors? I think I'm no authority to actually guys what or where this goes. No, but at least from my appreciation, I can say, no. these are sciences, scrutiny, okay? They have, value in the way they are done. What we need to be doing from dentistry and from dental public health specifically, okay, is adopting these so our programs are better planned, are better implemented, and are better evaluated, right? So we're at this part, right? You guys said, but Fabio, you said that now I would be able to plan, evaluate, and implement any program and evaluation, right? And I'm like, no, 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 no. I said that these elements are complex, has a lot to do with blending, yes, the science and the research, evidence-based science, right? But we have to blend this with creativity and experience, okay? And Camila will not let me lie that this is my face on the days that I'm in a bad mood, okay? So essentially it's that, okay? It's very complex, right? And I think it's a lot of the times for us very hard to understand how we do this within dentistry because I'm guilty. Dentistry is very like this a lot of the times, okay? I always say I'm really square. I'm really square in my thoughts sometimes, okay? And what's really nice about these sciences is that they invite you to think about the problem from different perspectives, from different levels, and in different contexts, right? That's also why we have so many theories, so many models, so many frameworks, et cetera, et cetera. Okay. So, I mean, essentially, with this, what I'm saying is that this is a very small introduction into very big sciences. Okay. These are very big and very broad. I try to keep it simple and concise today, but there's so much to talk about each one. And they're specialists. They're specialists in evaluations. They're specialists in implementation. Okay. So honestly, these are very interesting fields that are very important, especially in our contexts of Latin America, where a lot of the times you're like, they doing that? Like whose idea was that, right? And we have a saying in Mexico, que no tiene ni pies ni cabeza, right? Okay, where it's like you don't really understand why and how things are being done, right? So yes. So as the main the takeaways from today, and before we move on to the questions, I just want to think about this, right? Us to think about this, right? That they're all sciences of their own, okay? And when we think about sciences, obviously we have to think about scrutiny, we have to think about rigor in methods, okay? But we also have to think about real life feasibility, okay? Because these are health services, okay? Health services mess. Let's just be honest about it, okay? If you're in the clinic, public or private, it is a mess, okay? So essentially, think about, yes, being very strict and being very rigorous, but we also have to think about the real context, right? We have to think about the real situation that's happening with the clinicians, that's happening with the patients, right? So design and methods are the limit. Like I said, there's types and there's a lot of specific ways that you can define different types of evaluations and different types of implementations. But the way you can mix things is really, really nice. Okay. And here I put it here, mixed methods are very useful. Okay. Because when we think about health services, we have to think about that, yes, we want clinical outcomes. We want to reduce caries. We want to save the world, right? But we have to think about the patient. We have to think about the impact. We have to think about the qualitative aspect, okay? So a lot of evaluation and implementation science is mixed methods. It takes quantitative and it takes qualitative, okay? So this is something that's really important, especially for the folks that are interested in mixed methods research. And dentistry has a lot to learn from other areas, right? But we have a lot of opportunity to grow on our own, okay? We have very interesting we have very interesting systems, in pediatric dentistry, if I can get personal, the question is always like, why can we not reduce caries rates? Why can we not reduce caries rates? We know that fluoride varnish is really, really good, right? But then what I'm thinking now is varnish is really good. I mean, fluoride is very good. Art, glass ionomer cements are very good, but they're not being implemented correctly. We're not implementing them in the way they should be, and programs are not being planned and evaluated in the way that they should be, right? So we have a lot of opportunities within dentistry to grow this, and the resources are there. We need to take it, but we also need to build kind of the resources on our own for our own people, let's call that. Okay, very good. So I'm sorry, I know that was very fast. I just try to be mindful of the questions that we have coming up. But I guess now I'll take a moment if there's any specific that came out of the presentation before we move on to the specific questions. I would be more than happy to talk about it.
Thank you, Dr. Fabio, for the perfect explanation. You should be a, I don't know, maybe a teacher at university.
Thank you. That's very
Yeah,
kind.
the explanation of the examples are very, very good. I have
Thank
a
you. That's very
question.
kind. Yes.
How we can implement this planning, implementation and evaluation and undergraduate programs? Because I don't know if you're in your university, but we go to the communities to make programs to fluoridation or things like that. But it's the first time that I really start thinking, wow, what program needs all of this. And at university, we really don't do that. So how I don't know, teachers or students can implement this, because the course only have 1 year to make a program, and I'm looking the articles and 10 years more years, so we don't have this time and undergraduate. How?
Yeah, of course, and as soon as you started asking me, I thought, I wish I had a more exciting answer, but my answer is this: structure. Structure. We need structure, and that's the problem. That a lot of the times have all of these excellent ideas, and maybe we have the best intentions, we want to do and we want to make change, but the problem that a lot of the times we're lacking is structure. And essentially, the science behind implementation, the science behind evaluation, it gives us structure. It helps us think about this from beginning to end, right? And everything in between. So once again, right? It's like, okay, I take out my tortilla. What am I going to do with my tortilla? Okay. Am I going to fry it? Am I going to bake it? Then I take out my meat. What am I going to do with my meat? Am I going to put some oregano? So essentially it's structure, right? And I think it's what we need to be taking from these sciences, right? If I want to plan something, I need to think about every single thing. And I think a lot of the times we just think about, oh, how much money? Okay. Oh, the time. How much time, right? Oh, the people, right? But we don't think about going to do it a lot of the times. We don't think about what the community actually wants or what our population actually wants, right? And we don't think about how to best do it, right? And that's where implementation comes in, right? Like, how do I do this? My idea can be excellent, but it's not the correct idea for this context. It's not really something that's going to work here. So I do okay, my taco is just okay. But the end of the day, it's what was your actual outcome, and like I said, I wish I had a funner response to this, but I don't see another way around this, but structure. And where do we get structure? We get it from these sciences, right? We get it from these fields of knowledge, right? Because there's a lot of theory, there's a lot of model, there's a lot of description around this, right? So at least talking about that setting, yeah, I completely agree, I completely understand. what needs to start happening is planning stuff in a more meticulous manner, right? Where we think about every single thing. We think about, okay, we're going now, but then we're going in a year. Okay, what's going to be the outcome? And that comes a little bit more to the language that is used in these sciences, right? Maybe you read about it in the paper. We talk about reach, we talk about aim, we talk about penetration, we talk about sustainability. Okay, we talk about all of these all of this that are used to understand how programs are best sustained, right? So I mean, I hope I answer your question. I don't know if Camilla has something here to add or ask.
Yeah, I only wanted to add also that, as Fabio said, implementation science is kind of new. And it's more new in dentistry, I think. Like the first time that I heard about this was because Fabio was reading about this like this year, the last year, and then in IADR we started listening a little bit more, only a little bit. Uh, um, but it's something new, and I think that also because it's new, most of the literature about this topic is in English. That's why it's very important that we learn English, because unfortunately science is in English, and unfortunately our professors in most of our faculties
Don't speak English.
doesn't know, and so they will not be able to understand these new research topics. And most of the researchers who are experts in these topics only speak in English, or and and well, in this case, like Fabio is becoming an expert in this area, and fortunately he speaks Spanish, and he maybe can give us a talk in another day in Spanish. But what I'm trying to say, like, we have this barrier that is the language. That's why we are doing these discussion forums in English. And if our professors in the universities don't like explore these other areas because of this gap, that will be complicated. But well, okay. I'm going to share my screen with the questions to review it very briefly.
Yes.
Okay, so because there maybe most of some questions are already answered during the presentation.
Yeah.
But let's review it. And if you have any other question or any other comment that you would like to share with us in English, yeah, try to do it in English, because this is an opportunity to practice. But if not, like, do it in Spanish. It's okay. The most important is that we learn something. So okay, let's start with the first question. That maybe it's already solved, but let's see. So okay, Abigail.
Thank you. So we have 10 questions. This is the first question. Okay, how is research in fields such as material science, behavioral science, and health services expected to contribute to improving oral health?
Yes. So I found this question really interesting, and I think I'm going to tackle it more on talking about the behavioral and health services aspect of it. And the reason why I think this question is important to talk about is that when we think about dentistry and when we think about what the clinician does, right? And we need to think, oh, like in my head, we always need to think about the clinician, right? So we can be in dental public health, maybe at a higher services level, but we always need to think about the targets, right? Clinicians, patients, et cetera, right? So what I think is really important here is that we cannot separate the patient from, like, we cannot separate the mouth from the whole patient, right? And this is where behavioral science really comes in, right? Where we need to look at psychology. We need to look at behavior models and behavior theories to better understand why a lot of the times interventions that we are proposing, even the treatments that we're giving to patients, are not working, right? So it's like, why does this kid that I have told him time and time and time and time again to brush his teeth 3 times a day, blah, 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 or even the parent, right? Like the parent doesn't understand or doesn't care, right? But we need to look a little bit towards behavioral science to be like, okay, repetition doesn't work for everybody. You know, we have to individualize. We have to understand, oh, this works more in this context. This works more in this context, right? So in a way, you know, I think dentistry and just health in general needs to be a lot more anthropologized, right? We need to draw a lot more from understanding the human, so our clinical outcomes are better implemented, or are better adopted, right? And we need to think about this from an individual level, but we also need to think about this from the health services level, right? So, you know, like I mentioned, a lot of evaluation and implementation takes from social behavioral sciences because they understand the importance of this adoption.
Behavioral science, for example, like motivational interview, maybe.
So that's an example. That's an excellent example that comes from behavioral science. Yeah, and that's been explored in dentistry, right? Like that's definitely a very good example.
Okay, thank you. So next question. Okay.
So I think we already addressed this. You know, be fully incorporated 17 to 20 years is what they talk about. Yeah. So I'm just saying for the sake of time, because I'm looking at time and
okay.
that's a good question. Yeah.
How does dissemination research differ from implementation research, and what are some of the challenges addressed by dissemination research?
Yeah, so this is really important, okay? Because this is an important word over here, dissemination, okay? So dissemination and implementation science are a lot of the times, they're put in the same box, okay? And another word for dissemination is, yes.
Sorry to interrupt you. For some moments, we couldn't hear you, maybe because of the headphone.
Oh, I'm sorry. Can you hear me now? It might be my internet, eh?
Okay. Yes, we can hear you now.
Perfect. But tell me so I can repeat in case.
Yeah. There was only a moment at the beginning when you were
When you apart from the screen?
Okay. Yes. When I'm doing my dancing, that's what I call it. When I'm doing my dancing.
Okay.
All right. So dissemination is really important because dissemination is where patient science was actually born. And if we take it a step back, it's diffusion. So there's diffusion became dissemination. Okay. And dissemination is the same context as knowledge translation or knowledge mobilization. Okay. It's the same concept. Okay. The gringos use dissemination. Okay. The US, the people in the United States, they use dissemination. And in other contexts, like for example, Canada, they use knowledge translation or knowledge mobilization. Okay. And essentially, the idea is, how do I get my idea, my research to actual care, to actual implementation? Okay. So the differences are, implementation is the science, implementation is the methods of how to do it, and not knowledge translation, knowledge mobilization, or dissemination is kind of the final part. Okay. How do I put it out in the world? Okay. So how do I communicate or apply my science to policymakers? How do I do it to patients? How do I do it to healthcare providers? Okay. Because the problem is that, no, a lot of the times the researchers talk one language, patients talk another language, policymakers talk another language, healthcare providers talk another language. So that's the idea behind knowledge translation, mobilization, or dissemination. Okay. It's, how do I make sure my program, my idea, how do I get all of this to the people that need to get it. Okay, so there's a difference because they're two different concepts, but they work together. So implementation is how do I do it, and knowledge mobilization or dissemination is how do I get the message? How do I get it out there? How do I translate it better? Right? And what are some challenges addressed by dissemination research is that, right? Everybody speaks a different language. Everybody has different priorities. So the dissemination is essentially that. How do we do that better? Especially.
Okay, next question. What are the common challenges in translating public health research into public policy and practice? And how can dissemination research help address this issue?
Yeah. So this is, like I said, like a very important topic or a very important thing that dissemination research looks like, right? And what the common challenges essentially are, right, is that I would say that everybody has different priorities and everybody has different ways of doing things, right? So, example, dissemination strategies for researchers are journal articles, publishing in journals, going to meetings, and presenting your poster, presenting your oral presentation, etc., etc. But the point of that, what is the point of sharing your research beyond communicating it to other researchers? Like, that's good, it's important. To other researchers and other scientists is good, right? But the same science, and it's never going to get to the rest of my audience, right? So that's the first common challenge, right? That the priorities are different and that the way that we do it is different, right? I would say another challenge, and it has to do with priorities, is that there's not enough resources, right? Okay, so I'm here, right, as the researcher, right, and I want to get my message, okay, to the patients. I want to get my message to the clinicians. I want to get my message to the policymakers, okay? So this, like, let's call it this dissemination road takes time and it takes money. Okay, because you have to design, maybe for the patients, you have to design, let's say, informational meetings or pamphlets or brochures. Okay, for the clinician, you have to hold kind of like a fancy dinner or a luncheon, or you have to find a way to give it to them, right? With policymakers don't have a lot of time, so you have to invest time into putting together policy briefs, into putting together material that they will consume, and that essentially it's like, okay, my idea was correctly disseminated amongst the people whom it should be disseminated through, right? And this is a very simplistic way of looking at it, right? Because it gets more complicated. For example, if we think about indigenous populations, right? How do I disseminate science done with a Western lens? Let's call it, like a American or a European lens. How do I disseminate that science in a correct manner that's culturally appropriate, or that is going to be accepted by the community, right? So there's a lot of moving parts with dissemination, right? What we should be more aware of or more working towards is making sure everybody that's supposed to be getting the message is receiving that message in a way that they can understand it and in a way that it can be useful for them.
So we have to use different in our language, but to the community, to the police, to other
strategies. Yeah, different strategies.
And this takes time, because we don't speak in the same way to community or to our patients, to our other things.
Yes, exactly, right? Maybe to your patient you say el empaste, but within clinicians you say la resina, right? So like that's an example, right? Like that's an example of how we need to be much more aware of how we are communicating and getting our points across, right? You know,
Mhm.
maybe to the kid, you're like, you know, to Coronita the Iron Man, right? But you know, to the clinicians, you gotta be like, you know, stainless steel crown or whatever, right? So yes. Being a lot more aware of the audience is really important.
I just wanted to add something like that it's very important to plan this part not at the end. We have to think about how we will do the dissemination at the beginning because we have to think who will be the people who will receive all of this information. So this is something that we plan at the beginning, not at the end.
We have to know how the community thinks.
Who are the decision makers? Who are the patients? So we have to identify all the people involved in this before we do something.
Mm.
Yeah.
Yeah, and I'll actually go a step further. There's this concept, integrated knowledge translation. So integrated knowledge translation is when you do precisely what Camilla is saying. Okay, you involve the people that are interested. Okay, this is community people. This is knowledge users. That's what they call them. So a knowledge user would be anybody that will use the knowledge you're going to produce in the end, right? And essentially, the best way to do knowledge translation, the best way to do knowledge mobilization, the best way to do dissemination is by doing it integrated, which means you don't do dissemination at the end, you do dissemination at the beginning, like Camilla says. You don't do it, you think about knowledge translation and knowledge dissemination at the beginning. Yes, you might do it at the end, but you could also do it here, and you could also do it here, and you could also do it here. Once again, the world is the possibilities depending on your resources, context, research question, etc., etc.
Mhm. Interesting.
I'm going to
Okay,
move to the next question.
next question. It's number 5. Why is program planning described as a dynamic process with multiple interactions among its components?
Yes, I think this is a really important question. And I think it goes a little bit maybe against what I said at the beginning, right? And bear with me, right? So I think the important part about here is that we think about program planning as, you know, multiple interactions, like we said, with different parts, with different components, right? So I said that program planning, you know, is the most linear of the three, of implementing and evaluating, right? Because maybe you start with the idea and you finish with an outcome, right? But there's multiple interactions, right? There's multiple components here, okay, in between. But the reason why we need to think about it as being dynamic, right? A dynamic process is because maybe you're doing implementation here and this is evaluation, but you're evaluating while you're implementing, okay? Or maybe you're doing, let's say, you're designing your strategy. Let's call this design, but maybe you measure the implementation during the design. And that way you change the design if it's necessary before you actually implement it. Okay. So the idea there is that times we are taught to think in just, you know, like this. It all goes like this. It all goes like this, right? When in reality, things move, right? And if you're, I would say, creative and skillful enough, you can find a way to mix these different elements as your program or as your intervention is being implemented in a way that's beneficial, right? Because it's really, really bad when you plan something and then you get to the end and you realize it doesn't work at all. Zero. There were so many problems with it, right? And you know, failure is part of science. That's you know, essentially that's what science is. You know, understanding failure. But obviously, when time and resources are limited, if there's a way that you can better understand how to do things as you're doing them, then that's the dynamic part of it, okay? Of being able to say, "Ooh, I need to change this," or "Ooh, this would be better like this," or "Oh, let's say my dentists are not using this the way they should be using. What needs to be changed? Is it behavioral? Is it training? Is it motivation? So that's why it's dynamic, right? Because it's got a lot of moving parts that we need to always be very aware of.
Thank you. Our next question, why is it important to engage community stakeholders in the planning process of community oral health programs, and what benefits provide?
Yeah. So I mean, I know this question is towards oral health programs, but I think I'm going to try to answer to the broader idea, right? Or a broader population, right? And it has been proven time and time and time again with lots of research that if you do not involve your community, if you do not involve your users, if you do not involve your target audience in designing, in implementing, and in evaluating your strategy, then a lot of the times it's doomed to fail. Okay? And this goes back to what I was saying at the beginning, that different communities have different needs and different priorities. And if we don't think about that from the very, very, very beginning, and if we don't have support, that's also something important. And that's also one of the important things about engagement. If we don't have support, a lot of the times these ideas are gonna work as they should, or they're not going to be adopted, or they're not going to be accepted, or they're not going to be, happily taken, right? So that's essentially the problem, right? That we need to involve, and I say community in the broader sense, community members, community partners, community leadership from the very beginning, right? Because then they will also be able to tell us reality is, right? Because maybe in our little scientific heads, we have an idea of what should be done and how it should be done it, but we're not on the ground. We're not there. We're not with the people. So essentially, context matters, and it matters a lot. Okay. And this is essentially where involving the community, I'm going to capitalize it because community should always be capitalized in this meaning, right? Giving it the importance. It's just really, really important for success, I would say, and this is me saying it from my opinion, but there's a lot of evidence that's behind this, right? Where community is key for success.
I have a question. For example, if we have a program, and in Peru, la majority of programs are made in Lima, that is capital, but we have so many communities, rural communities. It's important to translate, to change. And I think this is difficult because make a general program for the country and then make for specific rural communities. I don't know if it's possible.
Yeah, no, yeah. Well, that's the thing, right? And obviously, I'm talking about ideal situations. Let's talk about it like this, romanticized situations, right? But essentially, that's the thing, right? We need to start changing that mindset. We need to start thinking of like, there's an expression, no, one brush can't paint all. We can't paint everybody with the same brush because everybody's different, right? And you talk about Peru, and I think a lot about Mexico and Guatemala that are very multi-ethnic. No, that's maybe a little bit of what you're getting to. We're multi-ethnic. We have different geographical and socio-political contexts that are different from place to place, right? So the ideal thing would be to individualize our programs for each one of these contexts, right? Obviously, the barrier that we have here is resources, right? Because a lot of the time, utilizing programs a lot of resources, right? So essentially, from a health services standpoint, you want your outcomes that you're going to look at to be the same, right? your outcomes should be the same or very similar so you can compare, right? But you need the middle part be individualized, right? Or maybe be tailored for a specific context, right? If you know a geographical challenge is something that you have, if cultural challenge with like a language barrier is something that you have, right? If there's a community, especially in, you know, multi-ethnic settings where racism is a problem, you know, maybe, you know, Lima, you say Lima, I think about Mexico City. Maybe they don't think about that. They don't think about racism. They don't think about inequity. They don't think about these being barriers, right? But that's the importance, right? That's the importance of individualizing. We should try to do it the most we can, but especially at a macro level, that is a challenge because resources are so limited.
Yeah. Next question. Let's emphasize that data, no matter how good, are meaningless unless they can be analyzed and interpreted. How does the interpretation of data contribute to the effectiveness of community oral health programs?
Yeah, right. So this is important. I think from the point of thinking about it, yes, from planning, evaluation, implementation, but just in general, like maybe as a more broad scientific idea, right? Because we need to be able to analyze and interpret data in a manner that makes sense, and especially in health services, in a manner that is impactful, right? We want this data that we collect from whatever we're doing to be impactful, right? So also a lot of the times where integrated knowledge translation comes in, okay? Because maybe as researchers or scientists, you have all this great data, right? Maybe. But if you don't know how to interpret this data according to the context, then a lot of the times the data is meaningless, right? Or it could be numbers, it could be good numbers for you, right? Um, but if it's not actually going to impact and make change, then what's the reason doing it, right? And that's why integrated knowledge translation is so important, right? Because if you involve or if you integrate the different people or the different agents from the beginning, then they can help you guide, design, implement, interpret that data as well, right? Because we all have different lenses or we all have different world views of seeing things, right? So, I mean, like I would say, you know, like I would argue, have had the opportunity to move to a lot of different places. So, say that I can go somewhere else and say, "Oh, I understand your context. I understand your data." Um, because I'm not in that context, right? Like if I were in that context all my life, that validity, interpret that data, right? But hardly is that ever the chance or the opportunity, right? So that's where integrated knowledge translation is really important, involving the different agents, because you can have good data, but that needs to be analyzed and interpreted with these different agents, right? That's why we need to be more collaborative. And collaborative does not mean working with other researchers. Collaborative means, especially from a dental public health point of view, everybody that's interested in whatever research you're doing.
Okay. Our next question. What are the critical elements for ensuring that the lessons learned in a program evaluation are effectively used and disseminated? How do you strike a balance between technically correctness and practical use in dissemination evaluation findings?
Yeah, so this kind of goes back, right, to the main idea behind knowledge translation, knowledge mobilization, right? It's how do I get the ideas out to the community in a matter that they're understood, but in a matter that's also scientifically sound or scientifically rigorous, right? So that's the thing. How am I correctly technically? How do I practically use this knowledge, right? And essentially it's that, right? So lessons learned here is a context or a word, right? That I think is very relevant when we think about communicating to patients, communicating to policymakers, right? While maybe as researchers, you're going to look at it more like outcomes, okay? This is a word that's used in evaluation and implementation a lot. We're focused on outcomes. We're focused on what the end is and how what I did was measured, right? So that's the thing, right? You need to be scientifically strict, let's call it in a way, but you need to be practical in that knowledge and how you best translate or how you best give the community that knowledge, right? So it's a little bit of a balance, right? And I think it's a little bit of a compromise, right? It's a compromising act where you have to ideally have everybody happy, no? So you have to have the science people happy, you have to have patients happy. So it's that. It's trying to be, I hate this word, but a people pleaser, which is trying to get everybody on board and happy with what you're doing without sacrificing or compromising your scrutiny, right?
Indeed. Our next questions. There are campaigns against using fluorides as a health monster. Have you considered what interests are at play here, given that this is one of the most widely used tools to mitigate the disease of caries?
Yeah. So this is a problem, right? The whole situation around fluoride. I've already given the example of, for example, fluoride varnish, how it's very effective, but how we might not be implementing it correctly in different settings. So that's an example, maybe talking about implementation. But essentially, I think the wider problem here with fluoride in our current population is knowledge translation. Sorry to go back to the same thing, but it's that, no? Fluoride, curious arresting agent, is a victim of misinformation, you know? And the misinformation is so common in our times, right? We learned about it or we heard about it a lot during COVID with a lot of the misinformation that would come around vaccines, that would come around treatments, et cetera, right? And fluoride is a victim of that, okay? Why? Because there was 2 studies that in a very, very scientific manner laid out a hypothesis for fluoride being harmful, right? And with that is that the misinformation people just went ahead and ran with that, right? So essentially here, the problem with fluoride, I would say, is that we didn't do the correct job of disseminating the benefits in a correct manner, right? And what I mean by this is we have lots of campaigns. Fluoride is this, fluoride is one of the greatest dental public health successes in our lifetime, blah, 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 blah. I don't want to convince the people who already know the benefits of fluoride to convince the people that are against it, right? I need to convince, let's call it my enemies, right? I want to make my enemies my friends. I want to give them the taco that I prepared, right? So essentially the thing with that is precisely that, right? We need to have better strategies to get the people that are not on our side to our side. And I think there's something very interesting because there's a couple of papers on fluoride hesitancy that came out last year and this year. Dr. Donald Chi from University of Washington has a grant looking at that right now. And where I suspect he's going with this is there's a lot of research around vaccine hesitancy, after COVID. So those strategies that help make vaccine hesitancy a little less, or a little better, but we're gonna use those with fluoride. So what is the best way to engage the people that are fluoride hesitant? So I think there's something interesting coming up here, but in future research with this, and there's lessons to be learned from all these other public health contexts. but essentially is that I think the problem is we have all of these campaigns and we have all of this, but we're convincing the same people that are already convinced, you know? While we need to be convincing, like I said, I need to be making my enemy my friend.
Mhm. And some of this misinformation are in important journals.
That's the thing, right? You know, and the other thing is that the journals for people are TikTok and Instagram, right? So I mean that's another monster, right?
Yeah. Dental tourists in Peru currently inflate costs, language is a barrier, treatments are often completed in the shortest time, and without any follow-up. How could this practice be regulated?
So I found this question really interesting because I don't think it's my area, but I want to talk about it. Just because it's very common in Mexico too, right? So a lot of people from the US go down to the southern border, to the northern border or to other places. And I know this is a problem in Peru, problem in Turkey, with European populations, right? And to be honest, this is more of policy design, right? But I think this is a very important phenomenon, right? That we can learn from, and where we need to think about regulation. I really like that this word was brought up because a lot of the time, implementation and evaluation is focused on thinking about regulation, right? On thinking about how to better do things, right? So regulation is more policy, is more, it's another, I would argue it's another strand of knowledge, right? But I think a lot about this, not only because of the patients, but because of the dentists. Dentists need to be protected with this as well, so regulation and law is really important. And just reputation too, right? So I mean, things that are regulated normally or tend to work better, but regulation also needs to be evaluated. So that's the other important thing that I would add here, right? Is regulation being appropriate? Is it being correctly implemented? That's important as well.
Thank you. So now, if you want to share with us key methods that resume to the most important part of all that we are talking.
Well, everything that I said, right? So yeah, no, I think I'll just refer a little bit back to my last slide that I presented, right? How I invite you to look at planning, evaluation, and implementation as separate sciences with separate scientific rigor and methods, but that need to be integrated and that, one benefit the other, right? And essentially that a lot of the problems that we're having in dental public health are because we might not be applying these sciences in the correct manner, right? So especially this group that our future researchers, our future scientists, our future clinicians, and everything. I just want you to think a little bit. I invite you to think a little bit about that, right? About how there's a lot of problems day-to-day dental clinic that if they had a little bit more structure, if they had a little bit more planning, if they were evaluated a little better, then they would be so much more beneficial to the population, who is essentially the one that's supposed to be benefiting from all of this.
Thank you.
Perfect. So we had a very interesting discussion forum today. This topic, as Fabio said, it's very broad. Like Fabio tried to summarize it in a short period of time, but there are a lot of things to continue talking. If you are interested in, it's a very important topic too. So contact Fabio for more information for all of these papers that he was sharing. Before we continue, we finish this forum. please, I would like to have a picture with everybody, like as a memory of this day. So please
Turn on your cameras, please.
and the
Please.
tradition of every discussion forum. I know that it's very late for you, like most of you maybe are with pajamas. But if you're available to turn on your cameras, that will be great. So let's wait only a minute. So while you're turning on your cameras, I just want to share one last thing. Let me check here. Okay, you're turning on. Yeah, so while everybody's turning on their cameras, okay, who else? I just want to share this certificate for Fabio. Fabio, thank you so much for your participation today. It was amazing. It was a very nice opportunity to talk, to share a lot of knowledges. And thank you for your outstanding contribution as an expert in our dental public health study group, Qhali Peru. Your dedication and experience have been fundamental for the growth and learning of our members about dental public health, and we sincerely appreciate your commitment and unconditional support. And we hope to continue counting on your valuable collaboration in the future. So thank you so much, Fabio, for your time and for all the knowledge that you share with us.
No, on the contrary, thank you everybody for your time. Thank you everybody for being here on a Saturday night. I really appreciate it. I hope, to be honest, I hope I made more questions than answers, because then I hope that makes you curious. And like Camila said, please feel free to reach out. You guys have my contact information in case you want any of the papers, any further readings, or anything that might be of use for you guys.
Yes, okay, let's have a picture before everybody leaves. So, a smile. Abigail, can you help me with the picture? I'm also going to try to help. So, okay, 1, 2, and 3. All right.
¿Ya podemos
Okay.
hablar en español?
Ya podemos hablar. No, gracias a todos por conectarse, gracias Fabio. Es un tema importante. De hecho, ya habrá un momento para seguir compartiendo de esto. Y nada, este ha sido nuestro último foro de discusión. Estamos cerrando de una forma muy agradable justo con este tema muy interesante. Y ya les vamos a estar escribiendo para hacer nuestra reunión de fin de año. Así
sí.
que, y hoy día hemos hablado de Program Planning and Evaluation, y de hecho este grupo de estudio se planificó tratando de usar alguno de estos conceptos. Abigail va a compartir una encuesta para saber su feedback, porque de esa forma estamos evaluando qué tan todo funciona en estos discussion forums. Y nada, los espero en la próxima reunión para compartir algunas cosas antes de que se acabe el año. Así que nos vemos, que tengan un bonito fin de semana, buenas noches y nada, ya nos vemos pronto. Gracias, Fabio, por todo y nada, ya nos vemos pronto.
Gracias, doctores. Muchas gracias.
Chao, chao.
Gracias,
Mucho
doctor.
gusto. Que estén muy bien.